Today we're talking about the importance of carers in decision making for patients, and in particular we're talking about the importance of parents as carers and their interaction with clinical staff and staff that are looking after their children. And we're delighted today to be joined by Alex Chitty, who works for our trust, but I'll let him introduce himself. So Alex, would you like to just introduce yourself, please?
Hello, my name is Alex Chitty and I am PA to the divisional management team in the South West Division. And I am also a carer for Leon Chitty, who has congenital heart disease.
Tell me a little bit more about Leon and how you care for him.
Thank you. So we found out when Leon was 20 weeks that he was born with half a heart and grand disposition of the arteries. So his arteries are the wrong way round and he has a free-chambered heart. So with that comes with complications with SATs, that's oxygen levels, keeping him warm, hydrated, obviously heart pressures as well. So he's had loads of operations all his life, leading up to his recent big one, Christmas last year, which was his Fontan operation. That was successful, but unfortunately due to too many surgeries and damage to his lymphatic system, he has now got something called plastic bronchitis. It is very rare, to the point where he is the only child under 16 to have it in the UK. So this is huge complications on his well-being and his day-to-day life. Unfortunately, now he is palliative with a very high mortality rate of 5 years. So our level of care has stepped up massively since last Christmas, when we nearly lost him due to the plastic bronchitis. But it is a day-to-day, hour-by-hour monitoring and supporting him, and SATs and oxygen levels are our life. So it's a multifactorial thing, looking after a 7-year-old boy with lots of complications.
And Alex, how has it been working with the clinicians, the doctors, the consultants, the nurses that have been involved in Leon's care?
Frustrating, but not every part of it is frustrating. The nurses in particular on the ward are some of the greatest humans ever to grace us with presence, because they kept me sane. 6 months in hospital can send you a little stir crazy. But when you get nurses that are humans and like a good laugh and keep you entertained, as well as looking after your child, they are superb. But it just gets a bit more difficult when you get into the consultants and doctors. Communication seems to break down a little bit, and we have had to put our foot down on quite a few number of times in regards to his care and the quality of his care.
And why do you think that has been?
I think that's only because of our background of knowing too much. I used to run care homes and nursing homes. I now I've been with the NHS now for 12 years, working with many, many teams, and I think I just know a bit too much. I'm not clinically trained, but I've worked alongside people that do the processes that were happening to my son, and I shouldn't have ever been in a position where I had to pull them up on processes that were doing incorrect, and then have apologies to say, yes, you are right. I don't reckon if I would have been in that situation if I didn't have my knowledge or just my background.
And a lot of carers don't have that knowledge or background. So how do they navigate, or how do you navigate the way you work with healthcare professionals then in that respect?
It is trust. They've got to get to know you and you've got to get to know them. And that is paramount to any care or treatment receiving, going for any patient. And to not be listened to is awful. If you're a patient or a family member or a carer of a family member or your child, when you're not listened to, it's frustrating. But when you get that person that listens to you, you need to keep hold of them. But it's trying to get everybody to listen, because sometimes you might not be clinically trained, but you know your family member or your son, daughter better than most really anybody else in the world. It's a challenge.
And can you give us a couple of examples, perhaps, of where you've had that challenge and how you've overcome it?
Sure. So my son was fed via TPM. Part of the complications with the surgery he had, they needed to not have anything go through his stomach for 3 months. So the poor chap was fed on a TPM. So this is a bag of nutrition that's fed via a PICC line. So this is quite a quite high risk thing to go through your PICC line, unlike a medicine, because it is nutrition. So the chances of bacteria and things multiplying in these areas are significantly higher. So I would watch them daily, change this bag, but not do the proper procedures, and it would constantly get blocked. Problem is that when it get blocks on the ward, this isn't just a quick, let's give it a flush and fix it. This is another procedure, which puts him at risk, because we can't sedate him because of this plastic bronchitis. That's what we nearly lost him, because we sedated him. So again, this is to try and prevent that from happening. So you need to follow procedures properly. So I know that they have to use certain medications after a flush just to stop the PICC line from coagulating. I think if I remember right, it's called Heplock, and it just sits in the line. And then just before they go to reuse it again, they pull it out. They don't flush it into, they pull that out, flush the line, so it's free and fro to use. Or this wouldn't happen, and they would just do a normal flush straight away. And unfortunately, they gave my son sepsis, and this doubled our stay in hospital. We were so close to being discharged, and he was out of bed playing with a kid, and within minutes he was hallucinating, and everything went downhill rapidly because of how quickly the infection set in because of the PICC line. After querying it, which I advise you, if you don't think anything's right, you are entitled to question it. Whilst you're in hospital, you have teams that will help you, like the InReach team. Well, we did question it, and I did question their policy, and it was brought back to me that they were treating it like a cannula, because the ward is so used to babies, and they use babies. They don't use PICC lines for babies, they use cannulas, so they was treating his PICC line like a cannula, and they made him poorlier. It's sad that I had to bring that to their attention, but there was lessons learned. This was brought to the attention of the matron, who then apologised and said this will never happen again on my ward.
And how do you retain trust in the way that they treat your son then after incidences like that?
You can't hold grudges.
Right.
You get nowhere in life holding a grudge. You're going to be angry. You are going to lose trust, but you can gain trust. Kate, this is one incident out of all the fantastic stuff they've done on that ward. I've never had to pull the nurses directly up on that ward because they've been amazing humans. So you can forgive and forget, but this just highlighted to them properly that Mummy and Daddy are paying attention when we're in. We are observing everything they were doing, and we're not just going to sit back and be quiet if we don't think something's not right.
Yeah.
And everybody has that right.
And I'm sorry you had to go through that, Alex. Can you think of anything, any examples of where they had good communication with carers, with yourself as carers in the hospital?
Yes. Direct with my son, he's not diagnosed as ASD, but everybody had an inkling, and the way they treat him was brilliant. And to get him, they had to gain his trust. And in particular, there was a nurse called Aggie, and she was amazing. And she would come in, and she would talk to him like he was a bit of banter. In a way, would be fun, and wouldn't just get straight in to do medical procedures. She'd tickle his feet first, she'd crack a joke, she'd tell him to look over there and then touch him under the chin, just, the little silly little things. And that, no matter what Aggie wanted to do, he would let her do it, because they just built this trust and this communication up. Some doctors would come in and talk, and then they'd disappear. And you're like, oh, what are you talking about? You run after them. Hands down, it got to the point where it was frustrating the nurses so much that I overheard a nurse in the corridor tell them, you need to go back in there and explain what you've just said to those parents. So the nurses knew, but the doctors wouldn't, because the doctors constantly change, consultants change, they're not there all the time, they do shifts, so the communication does break down, but the nurses were always on our side. But they are not the ones that decide the treatment, are they?
No.
Or the plans, or the operations, or the long-term stuff.
So, Alex, as you're looking at your experience as a whole, what message would you like to get across to two groups of people, really? One is the staff that work in the healthcare, and also, secondly, carers like yourself that experience having to care for their children through these kind of circumstances. So, for staff, what message would you want to get through to them?
Listen, the family, to patients, just that listening, and actually not just nod and go, yeah, pay attention to them, and then get to know them as a patient, not just an illness or a statistic or, oh, that's rare. Just listen, and you will go so far with so much things. You gain the trust of your patient. There's just so much to listening that people take for granted. And that's the best bit of advice I could give to anybody in our job. We're all here to help.
When you're listening, you don't mean just paying lip service to listening. You mean actively listening, taking on board some of the things that parents might be saying, because let's face it, parents know their children the best, don't they? And they have an important role to play in providing that evidence and that experience and that history about what's been happening to keep that continuity of care going, haven't they?
Yes, massively. But it's, again, a lot of our issues were because we were not listened to for months, and it was finding that one person that would sit and listen. And they are still now our saviour. One physio and a doctor that listened, that had they weren't the specialists, but they went, oh, let me go seek some help. And not just go, oh, I don't know. Can't be that.
And that's quite humbling to hear someone saying, I need to get some help with this, because as you've explained, your son's got a very rare condition, so there's not a lot of history of how to treat these things or what to look out for. But the combination of your knowledge and the healthcare, the support people that did listen, have helped you be able to maintain that, haven't they, or manage that?
Massively.
Yeah.
And it took until the night of intensive care, when we nearly lost him, for somebody to recognise for months what me and my wife were doing. And they said, you kept him alive by just keep on going at it and going at it.
Yeah.
And that, just those few comments, reassured us that what we did was right.
Yeah, gives you convictions to carry on, doesn't it? And so that brings me nicely on to what advice would you give to carers, those parents that might be going through a situation like yourself at the moment? You know,
sometimes just go with your gut. If you think there is something not right or wrong, get somebody to listen to you, or try and get somebody to listen to you. If that person's not listening to you, find someone else. You shouldn't have to, but if you honestly think something ain't right with your son, daughter, husband, wife, family member, or just somebody you're caring for, say something. Bring it to the attention of somebody, because you know them better than anybody else if you're with them day in, day out, caring for them.
Yeah.
And you know that the small changes, and sometimes it's those small changes that are the start of something, and you hear it on and off again. Oh, you should have come to us sooner. You don't have to be angry, you don't have to scream and shout at somebody, you just need to, sometimes you have to repeat yourself an awful lot.
Yeah. And I guess officially there's things like the carers' rights, aren't there, that you can kind of look at and talk to staff about. And I guess that works for both ways. There's that staff need to probably be more aware of the rights of carers in these situations, and carers need to be more equipped with knowing that they have the right to hear and speak to and contribute to the care of their loved one, don't they?
Yeah, I mean, me and my wife call it the white coat syndrome. A lot of people will have a doctor tell them something, they'll go, yes sir, I believe everything you say. Yeah. Actually, they will suggest treatments as with my son that weren't effective. There was no evidence, so they just wanted to just do daily injections as a, we'll see if it helps. No, you won't. Where's the evidence and the reason behind that? You just said it is a what if. They didn't know what to say because we said no to them. And I don't think they're used to too many people going, actually, there's no evidence on that. You can question things. You can say no.
Yeah.
If you're not right, and then you're allowed time to go and seek an opinion from somewhere else. There are people in hospitals that can provide you with that opinion.
And what else can they do? I mean, what other facilities are there in the hospitals where they can raise any concerns that they might have?
You've got your in-reach team. So when you're outside a hospital, you have your pals, which they will help you resolve and maybe even have learning lessons out of incidents that you bring to their attention. But whilst you're in hospital, you've got the liaison team, and they were second to none. They listen to us. They have trained medicals. They come up and they look at everything. And then they will go to the people looking after the patient and go, actually, you are causing them harm. You need to do something about this. And that's a clinical team within the hospital are there all the time to help. And there's, I think, posters all over the hospital, but you don't know or hear of them, really. We didn't know. We didn't know who to approach to until pals pointed us in the direction of them when we went to them to begin with.
Yeah.
And they were fantastic. They were, again, our angels whilst in hospital, whilst we were going through. Nobody's listening to us.
Oh, that's really good to hear. So just to sum up, what advice would you give then to your carers, or like in a couple of words?
Never give up if you think something's wrong.
Alex, thank you so much for sharing your story with us today. I wish you and your family all the best. And again, thank you for sharing. I think it will really help people that might be in a similar situation to you, but help the staff realise the impact that carers and the involvement carers have to give. And just a very simple message, just listen to them. Listen to the parents and the carers. Thank you.
Yeah.
Thanks.
You're
Bye.
welcome. Bye.